Good afternoon. My name is Trisha Lee Soley and my partner is Adriana Boo, and today we will be discussing dialysis. Before we get into dialysis, I'm just going to give a background information on the kidney. So, as we all know, the kidneys are two brown, bean-shaped organs located on the rear wall of the abdominal cavity, and they are protected by the rib cage. The kidneys are the primary functional organ of the renal system. They are essential in homeostatic functions such as regulation of electrolytes, maintenance of acid-base balance, and the regulation of blood pressure. They serve the body as a natural filter of the blood and remove waste that are excreted through urine. They are also responsible for the reabsorption of water, glucose, amino acids, and will maintain the balance of these molecules in the body. In addition, the kidneys produce hormones including calciferol, erythropoietin, and the enzyme renin, which are involved in renal and hematological physiological processes. So, a mnemonic that can be used to remember the indications for dialysis is the vowels, which is A, E, I, O, and U. So, A stands for acid-base problems, E stands for electrolyte problems, I stands for intoxications, O stands for overload, fluid overload, and U stands for uremic symptoms. In this slide, it states the indications for hemodialysis. So you have a BUN, which is blood urea nitrogen level exceeding 90. You have serum creatinine levels of 9 milligrams, uncontrollable hyperkalemia, medication toxicity, intravascular and extravascular fluid overload, symptoms of uremia, pericarditis, and gastric bleeding, severe metabolic acidosis, changes in mentation, and any contraindication to other forms of dialysis. So the contraindications for hemodialysis is the person is hemodynamic unstable, inability to anticoagulate, and the lack of access to circulation. Because in order for a patient to have dialysis, they must have a vascular access. Finally, we are now talking about dialysis. So, renal replacement therapy is dialysis. What is dialysis? Dialysis is a treatment for kidney failure that rids your body of unwanted toxins, waste, products, and excess fluids by filtering your blood. When the kidneys fail, your body may have difficulty cleaning your blood and keeping your system chemically balanced. So you have two types of dialysis. You have hemodialysis and you have peritoneal dialysis. Today I will be talking about hemodialysis. On this slide, it is a basic gist of hemodialysis and what happens in hemodialysis. My name is Trisha Lee, and today I'll be talking about hemodialysis. I'm pretty sure all of us had a rotation on the dialysis unit, so we know what the procedure for hemodialysis is. Hemodialysis can be considered as the separation of the blood. It is a procedure used during a patient's blood where a patient blood is circulated through a dialyzer to remove waste product and excess fluid. It is basically used for patients who are acutely ill and require short-term dialysis, sometimes days to weeks, or even it can advance to long-term because they may be getting hemodialysis for years. Hemodialysis prevents death, but it does not cure renal disease, and it does not compensate. Patients receive dialysis 3 to 4 hours in an outpatient setting, sometimes 2 times a week. Hemodialysis can also be performed at home by the patient and a caregiver. So the objective of hemodialysis is to extract toxins, nitrogenous substances from the blood, and to remove excess water. a dialyzer, which is known as an artificial kidney. It's the little tube-like thing would it be in the machine. It serves as a synthetic semi-permeable membrane, replacing the renal glomerular and tubules as the filters for the impaired kidneys. In hemodialysis, the blood, laden with toxins and nitrogenous waste, is diverted from the patient to the machine, a dialyzer, where toxins are filtered out and removed. These are diffusion, osmosis, and ultrafiltration. So, the toxins and the waste are removed from the blood by diffusion, in which they move from an area of higher concentration in the blood to an area of low concentration in the dialysate. The dialysate is a solution made up of all the important electrolytes in their ideal extracellular concentrations. The electrolyte level in the patient's blood can be brought under control by properly adjusting the dialysate bath. The semi-permeable membrane impedes the diffusion of large molecules such as red blood cells and proteins. Then next we have osmosis. As we know, osmosis deals with water. So excess water is removed from the blood by osmosis, in which water moves from an area of low concentration to an area of high concentration. The low concentration would be the blood, and the higher concentration would be the dialysate bath. After osmosis, you have ultrafiltration. Ultrafiltration is where water moves from an under high pressure to an area of low pressure. So this is a dialyzer, which is a hollow fiber device that contains tiny straw-like tubes which allow blood to filter through. They are porous, and it's a semi-permeable membrane allowing toxins and fluids and electrolytes to pass through. So basically, this is the blood coming from the patient through the machine, the toxins right here, and then you have the fresh dialysate. Stop it. Okay, so now we're going to talk about the vascular access. So vascular access is done to establish access to allow blood to be removed, cleansed, and returned to the patient's vascular system. So you have two types of vascular access. You could have intravenous fistula, or you could have an intravenous graft. So vascular access devices are immediate access to the patient's circulation for acute hemodialysis by inserting a double-lumen, non-cuffed, large-bore catheter into the subclavian, internal jugular, or femoral vein by a physician. These features make these catheters are safe for long-term use. Infections rate, however, remain high, and septicemia continues to be common. So now we're going to talk about the intravenous fistula. So this is the preferred method for permanent access. It is created surgically in the forearm by joining or anastomosis an artery to a vein. And in this picture, you can see where the AV fistula is, because you can see where they join the artery and the vein together. The arterial segment of this fistula is used for arterial flow to the dialyzer, and the venous segment for reinfusion of the dialyzed blood. This access will need time to mature, so before the patient can have dialysis, the access needs to mature, and it normally takes about 2 to 3 months before it can be used. As the AV matures, the venous segment dilates to increase blood flow coming directly from the artery. So once it's sufficiently dilated, it will then accommodate two large bores. So I'm pretty sure when we've been to dialysis, you see that they always insert two needles, and it has two lines coming from them. So now we're gonna talk about the intravenous graft. So the intravenous graft can be created by subcutaneously interposing a biologic, semi-biologic, or synthetic graft between an artery and a vein. It is usually created when a patient's vessels are not suitable for an AV fistula. So it is not at all uncommon to see dialysis patients with numerous or more than one AV graft, because sometimes one access may get old or the access might not be working properly, so therefore a new access must be made for the patient to have dialysis. So sometimes when you go to dialysis, the nurse might ask the patient which one is the newest AV graft or which one is working. Then the nurse must also check to see the presence of any bruise or thrill. Okay, so now we're going to talk about the complication of an atriovenous fistula and an atriovenous graft. So the complications of the fistula can include thrombosis, infection, inadequate blood flow, a pseudoaneurysm, where a pseudoaneurysm is when a blood vessel is injured and blood starts to leak into the surrounding tissues. The person could also have venous hypertension and carpal tunnel syndrome. So that's just some of the complication of the fistula. So now we're going to talk about the nursing management. Okay, so the nursing management involves teaching and doing certain techniques. So one of the techniques you must use when cannulating the access is use aseptic technique. You could also teach the patient not to sleep on the access limb or to have the limb bent for prolonged periods. You could also teach the patient to avoid wearing constrictive clothing around the limb that has the access. Teach them to develop proper blood flow by squeezing a rubber ball. You could also provide comfort measures by giving the patient pain medication if needed, or you could apply warm compresses. So that's just some of the nursing management to deal with the complications of the fistula. So now we're going to talk about the graft. Some of the complications of the graft include thrombosis, infection, arterial and venous stenosis, false aneurysm formation. That's just 4 of the complications that a patient can experience if they have a atriovenous graft. So for the nursing management, it's almost similar to that of the fistula. So you could also teach them not to wear constrictive clothing around the access. You could also teach, you as a nurse should also use aseptic technique when cannulating the access. You could also use comfort measures, as mentioned before, giving the patient pain medication or applying warm compresses. You could monitor for changes in the arterial and venous pressure when the patient is on dialysis, because the failure of the permanent dialysis access accounts for most of a hospital admission. So once the access is developed or once the access has been placed in the patient, it is of high priority that the access is kept safe, because the patient won't receive hemodialysis unless there's an access point. So now we're going to talk about the complications of being on dialysis. Being on dialysis can prolong life indefinitely. However, it does not alter the underlying condition of chronic kidney disease, nor does it replace the function of the kidneys. Vascular disease is the leading cause of death in patients who are on dialysis. So some patients also reported, patients with uremia reported that they have a metallic taste and nausea when they require dialysis between treatments. So vomiting and nausea may occur during treatment when the fluid starts to shift and hypertension occur. So this can account for malnutrition that is seen in patients who are on dialysis. The patient could also have dysrhythmias, which may result from the fluid and the electrolyte changes, and also if the patient is on antiarrhythmic medications and either the medication was removed or the patient did not take their medication before dialysis treatment. The patient could also experience chest pain, which may occur if the patient has heart disease or as a result of anemia. Also, About 85% of patients have reported sleeping problems, which can overall affect their health status. Nurse in the dialysis unit has some important roles, which include monitoring, assessing, educating, and supporting the patient during dialysis, because dialysis can be a very hassling and frustrating procedure because you are there sitting for hours with nothing to do with your arm held out, just waiting on time to pass by. So the patient and the machine can experience some complications. So a complication of the machine can be like clotting in the circuit. Complications of the patient could be like blood leaks or inadequate or excessive ultrafiltration and stuff like that. But the nursing management will be discussed in a PowerPoint. Promoting pharmacologic therapy. Many medications are removed from the blood during hemodialysis, so the dosage may require adjustment. Water-soluble medications are removed during hemodialysis treatment. Patients who require medication are monitored closely to ensure that the blood and the tissue levels of these medications are maintained without toxic accumulation. The patient must know when not to take their medication. So, for example, a patient who is hypertensive and is taking antihypertensive medication, hypertension may occur during dialysis, causing dangerously low blood pressure. So, with that being said, medications that are taken once daily can be held until after the dialysis treatment. Diet is important because of the effects of uremia. The goal is to minimize uremic symptoms and fluid electrolyte balance to maintain good nutritional status through adequate protein, calorie, vitamin, and mineral intake. In dialysis, the patient should limit protein intake, sodium, potassium, and fluid intake. So the goal is to keep their weight gain under 1.5 kilograms, and normally before a patient starts dialysis they are weighed, and after they finish dialysis they are also weighed. So potassium restriction is dependent on the amount, residual renal function, and the frequency of dialysis. Dialysis alters the lifestyle of the patient and family. Factors such as the time needed for dialysis, the doctor visits, the frustrations, depression, financial problems, difficulty with job, the fear of dying, and having children can all burden the family. The nurse needs to give the patient and the family the opportunity to express feelings of anger and concern about limitations that the disease imposes. Some patients may need counseling and psychotherapy. So, an example can be depression, where depression may require antidepressive agents, and also referring the patient and the family to a mental health provider can also be helpful. The patient at first does not fully understand or comprehend the impact of dialysis. So, as a nurse, you should continue with assessments. Assessments help to identify the learning needs of the patient and the family. So, when the patient comes to dialysis, the nurse can take about 10 minutes to educate the patient on the signs and symptoms of infection, the signs and symptoms of suspected complications, education on proper clothing, to make sure that the dialysis needle stick locations are rotated to prevent stenosis and thrombus formation, to check the function of the vascular access several times a day by palpating it and feeling for vibrations, to monitor for any bleeding after dialysis, to keep the site clean, avoid wearing clothing or jewelry that restricts the access, and to prevent anyone from using the extremity to obtain blood pressure or perform venipuncture. You could also tell the patient not to use the arm with vascular access, to carry heavy objects, and minimize sleeping on the arm with the vascular access.
Good afternoon, class. I'm student nurse Poe, and I'll be talking about peritoneal dialysis. What is peritoneal dialysis, you may ask? It is another form of treatment for kidney failure to cleanse the blood inside of your body. The doctor will do a surgical procedure to place a plastic tube called a catheter into the abdomen to make an access. A special fluid called dialysate flows through the catheter into the abdomen called the peritoneal cavity. This fluid stays in the peritoneal cavity to remove extra fluid and waste products from the blood After a couple of hours, the dialysate containing the extra fluid and waste product is drained out through the catheter into the abdomen. This helps remove extra fluid and waste products from the blood. The process is repeated with new dialysate placed into the abdomen to continue the removal process. Each time the fluid is removed and replaced, it is called an exchange. There are two types of peritoneal dialysis. You have CCPD and CAPD. CCPD is continuous cycle assisted peritoneal dialysis. This uses a machine called a cycler to do all of your exchanges. The cycle does about 3 to 5 exchanges overnight, which takes about 9 hours and lasts about 1 to 1.5 hours. It is usually done at night while you are asleep. The CAPD, which is continuous ambulatory peritoneal dialysis, it uses gravity to help you do the exchanges by hand, called manual exchanges. It takes about 30 to 40 minutes to drain and refill your stomach with the dialysate for each exchange. It is usually done during the day because you need to do each exchange yourself. These two types of peritoneal dialysis are done mainly at home, your workplace, or a clean and dry place. Challenges associated with being on dialysis. Fear and confusion is a very common one for new dialysis patients. Some feel like dialysis limits their freedom of movement. Some feel like it lowers their sex drive. Many feel like they have to limit their traveling. Depression is a major factor as well. It's like about 60% on dialysis may experience episodes of depression. Ways to cope would be you want to become more knowledgeable and experienced, knowing what to expect. Switching to peritoneal dialysis helps some persons who are uncomfortable with needles. It is important to eat right, take medications regularly, and follow dialysis procedures carefully. Choosing your own way is important for good coping as well. The main challenge for most people is to be realistic about the differences between before dialysis life and your on dialysis life. There are things that you can no longer do or you find it difficult to do now that you're on dialysis. We're going to move on to diet. Okay, physical activity. Regardless of what brought you to the point of kidney failure and the need for dialysis, it is best that you manage your physical health on a regular basis. Whether you have diabetes mellitus, hypertension, heart disease, etc. Healthy diet. You want to eat right. It will help you to stay healthy. It is very important that you have the right amount of protein, calories, fluids, vitamins, and minerals. You want to seek out a dietitian to help you plan your meals so that you can get a proper balance of nutrients. You want to try to also eat foods that are rich in omega-3 fatty acids, for example, like your salmon, your tuna, your sardines. Also, other foods like flaxseed oil, canola oil, and walnuts. You want to increase your physical activity by exercising regularly to lower cholesterol, lowering your blood glucose or controlling it. You want to reduce your blood pressure. You want to lose weight, and emotional health is very important. Labs to ensure that kidney failure is in there. You want to make sure your albumin to creatinine ratio is balanced. Your blood glucose level is normal. Your PTH, your hemoglobin, your KT, your lipid panel, your EKGs, and your echo. Overall summary: if you are a new dialysis patient, it is important to learn as much as possible about all options for treatment and ask questions. Always ask questions. You want to also stay positive. Look to others for help and support, guidance counselors, your pastor, family members, all of those things. I know that you are not alone. Accept the dialysis treatment is a permanent process. Adjust to the treatment and begin to enjoy your life. Not because you're on dialysis mean you cannot live your life. You can still live your life and enjoy your life. Also, you want to learn and stick to the rules with a proper diet, dialysis treatments, and fluids intake to remain healthy and to live a normal life. Thank you. It's a diagram showing you the process of peritoneal dialysis, or where the catheter is inserted. Here is another diagram. The first one is showing you the dialysate solution, which is hypertonic solution in the bag. The catheter with the dialysate fluid in through the line and into the abdomen, and then the bag at the bottom is the empty bag. Okay, the second picture showing waste fluid and chemicals in the peritoneal membrane with the dialysate solution in the abdomen still. And the third diagram is showing the dialysate being drained out, and then we will repeat the process all over again. Then we're going to talk about diet, your physical health, regardless of like what brought you to the point where you have kidney failure and the need for dialysis. It is always best to manage your physical health on a regular basis. Whether you have diabetes, mellitus, hypertension, heart disease, and so forth. Also, you want to maintain a healthy diet. You want to eat right to help you stay healthy. It is very important that you have the right amount of proteins, calories, fluids, vitamins, and minerals. You want to seek out a dietitian to help you plan your meals so that you can get the proper balance of nutrients. Also, you want to try to eat foods that are rich in omega-3 fatty acids like your salmon, your tuna, your sardines, and etc. Also, other foods like flaxseed oil, canola oil, and walnuts. Like I say, with the physical activity, you want to increase your physical activity by exercising regularly to lower cholesterol. You want to control your blood pressure. You want to control your blood glucose. You want to reduce your gaining weight and your emotional health status. You want to stay. You want your mental health to be intact, and etc. Your labs, your albumin to creatinine ratio, your blood glucose, your PTH, your hemoglobin, your KT over V, your lipid panel, your EKGs, your echo. Complications of peritoneal dialysis is the peritonitis, fluid obstruction, hernia, rectal pain, fluid overload, and protein loss. These are just some of the few complications that I named. Your nursing management, you want to check for infection of the abdominal lining. If it happens, then you want to administer antibiotics as prescribed. You also want to check for kinks in the tubing, ensure that there is sufficient fluid in the abdomen. Holding in fluid in the abdomen for long periods can put a strain on the muscles. You want to also use a slow infusion rate. You want to check the patient's weight daily, especially before and after peritoneal dialysis. You want to teach patient and family about signs and symptoms of infection. Okay, me and my colleague put together a case study, so I'm going to read it off. Mr. Brown, a 47-year-old male, has been his acute renal failure, which advanced later to end-stage renal disease. He is a non-diabetic and hypertensive patient. He has a right brachiocephalic fistula as his as his vascular access for hemodialysis. Mr. Brown presented to the emergency department stating that he missed 3 days of dialysis. He complained of shortness of breath, fatigue, nausea, and vomiting, a metallic taste. After assessing the patient blood pressure, 190 over 98 millimeters of mercury, pulse is 115 beats per minute, temperature is 99 degrees Fahrenheit, respiratory rate is 20 beats per minute, 20 breaths per minute, Oxygen saturation is 95% with 2 liters of oxygen via nasal draws. Blood investigation was done for CDC, C-reactive protein, electrolyte, urea creatinine, and the results showed that Mr. Brown is hypokalemic with potassium of 6.8, urea of 40.1, bicarbonate of 19, GFR is 13, blood glucose level is 180, albumin is 4. The current medication that he's on is calcium carbonate tablet, glucophage, day 6, and vitamins.